Hi, my name is Anita Wallace, and I'm chair of the Lymphedema Support Network, and I'm delighted to introduce you to someone that I've worked with for, scarily, nearly 20 years. Professor Peter Mortimer. He's the LSN's Chief Medical Advisor and leading lymphedema specialist both here in the UK and overseas. So next question, is there any way to help with abdominal lymphedema?
Well, I presume abdominal lymphedema here is referring to lymphedema swelling in the abdominal wall and not actually within the abdomen. If it's within the abdomen, we call it ascites, and that's very rare. But it's not so rare to have fluid actually in the wall of the tummy. So let's say particularly below the belly button. And that is a common occurrence in, for example, patients who've had lymph glands in their pelvis removed or had radiation to them, because those lymph glands in the pelvis drain not just the lower limbs, but also the lower abdomen and groin area as well, and genitalia. So I presume this question is referring to swelling that's in the lower abdominal wall. So is there any way to help with it? Well, of course, you have to ask, why has it occurred? Is it because of cancer treatment? Or is it for another reason? For example, and this doesn't apply to you, Anita, but some patients have a fairly rotund lower abdomen. So that there is, let's say, a little bit of a pendulous abdominal wall, which might hang down a little bit. Now, if that occurs, this is not in the cancer patient, this is obviously in the obese patient, then any abdominal wall that hangs down will collect fluid. Lymph cannot drain satisfactorily from it. And the more fluid that drains, the bigger the pendulous fold gets, and again a vicious cycle sets up. The other thing to comment on is that lymphedema is not just fluid. We know from studying patients with arm lymphedema after breast cancer treatment that 50% of the excess swelling will be fat not mobilized due to the failure of lymph drainage, because lymph drainage is important for mobilizing fat. And in the lower abdomen, fat is an even bigger element of lymphedema. So in fairness to those patients that might be obese, they really will produce even more fat as a result of the lymphedema. So how to help with it? Well, if you are overweight, the first thing to do is to try and lose weight, because obesity is terrible for lymphedema. I mean, it makes lymph drainage much, much worse, and obesity is a high risk factor for lymphedema. So losing weight, same principles essentially for lymphedema treatment, keeping active, doing abdominal muscle exercises, walking chest deep in water and trying to do exercises underwater. Pilates type exercises will be very good for abdominal wall lymphedema. And of course, if you wear some degree of compression, so okay, you might have to be trussed up with a sort of compression pantyhose or garment to compress the lymphedema area, but that combined with exercise and selected periods of MLD should help it. But I would say if there's any increase in weight, weight loss is the #1 requirement to help it. And then finally, if the patient has lost weight, thin, and there is excessive fat in the lymphedema, then liposuction could be an option. But I don't want every patient with abdominal wall and lymphedema go rushing off for liposuction. That's it's the last resort But if everything else has been covered, it is an option. It's in the frame.
Yes, I mean, liposuction, you know, is a whole different ball game, isn't it? You know, you need to be careful with who you're going to see, and it could lead to all sorts of problems.
It does, but the point I'm making is that fat is a part of lymphedema, and you cannot remove fat as far as we know with MLD, compression, and exercise. Well, exercise might help a little bit, but
yeah.
So it depends on every individual circumstance.
Yes, yes. Thank you, Peter. Thank you.